Dr. Bill Thomas, and I'm a geriatrician. So I'm a medical doctor who specializes in the care of older people. And I've actually spent most of my career not just taking care of people, but trying to improve the system we use to take care of people. And that's work that has really given my life kind of focus and purpose. I think my work with Nexus really fits hand in glove with my work with LifeSpark. In both roles, I'm really focused on how do we change the system to get better outcomes. And changing the system really, it requires conversation, it requires thought and persuasion. And I think that Nexus brings that into the world in a really powerful and useful way. In terms of my work as Chief Independence Officer for LifeSpark, we're really dedicated to building the tools and the technologies and the platforms necessary to make that shift from a world dominated by the hospital to a world actually that revolves around home and community-based services and supports. I think the biggest issue facing the world of aging today is the medicalization of old age, the turning normal human development into a pathology and then treating that pathology with very expensive and sometimes very dangerous medical interventions. I think we're in the beginning of a phase where we're going to see a demedicalization of old age and a greater focus on prevention and wellness as kind of the core experience of growing old. The revolution that we're talking about, the shift out of the hospital and toward home, is going to require a parallel revolution in reimbursement and financing, because really right now, a large fraction of the total healthcare dollar actually flows through hospitals. And in the context of aging, a lot of that money goes to pay hospitals to contend with the acute decompensation of chronic conditions. And there's one thing better than having an acute decompensation, which is having your chronic condition managed at home effectively. So I think as the center of gravity of the healthcare system moves away from the hospital and toward homes and communities, I think we're going to begin to see the development of financing mechanisms that actually reward and support people and organizations for helping elders live where they want to and how they want to. It's shadow and light. The shadow that, must be acknowledged is the terrible toll that COVID has taken on elders, on people who work with elders, on organizations committed to caring for and supporting elders. It is terrible. And I see a glimmer of light that says this trial and tribulation, these hard times, are going to open up new possibilities for better health and well-being, paradoxically, in the long run. So my hope very much is that this is not a crisis wasted, that we actually take our learnings, take our grief with us and take the learnings we gather and use these hard times to make something better. I've known Bob Kramer for a long time, and I've had lots of very spirited debates with him, and I've learned a lot from him. And actually, when he asked me to be a Nexus Fellow, I jumped at the opportunity because I knew that he would pick interesting people as fellows. And I have to say the regularly scheduled fellows calls that we have are the most interesting thing on my calendar. Because they're the most interesting people, the most provocative ideas, and Bob really keeps the conversation going, always with a focus on what can we do? How do we make a difference? And that's just sweet time for me to be involved in those conversations. aging is a team sport. And the faster we move to recognize that families and communities, neighborhoods, friends, allies, that more we build connections, the stronger and more vibrant the older people in America will be. So it's not just about the person, it's about the people that person is connected to.